Hello, everybody, and welcome to this discussion on the Coombs test. The Coombs test is something that can confuse a lot of people at the medical student, even resident level, because there's an indirect and a direct Coombs. In this video, we're really going to talk about the differences between those, when you'd use one versus the other, and how to interpret it.
Alrighty, so let's talk about the Coombs test here. So before really going into some of the nitty-gritty details, let's just talk about the theory behind the test. What would make you think that it's a good test to order? So when we think about hemolysis, that's red blood cell hemolysis, you can have an RBC hemolysis caused directly by antibodies or complement that you yourself make, so autoantibodies causing hemolysis. The antibodies, which are usually IgG or IgM, and when it comes to complement, it's usually C3, will directly bind to these red blood cells, causing the hemolysis. And so the Coombs test is what you would use to determine if these antibodies or complement are present on the RBCs or in the serum and can potentially cause a hemolytic anemia. So there's two types of the Coombs test, the direct and the indirect Coombs test. The biggest difference to know is that in the direct, you're using your patient's own RBCs as the reagent. And in the indirect, you're using donor RBCs as the reagent. And in other terms, when it comes to the direct, you're seeing if your patient's blood has these autoantibodies already on it. And the indirect, you're seeing if these autoantibodies are simply in the serum. Now, in practice, we really only use the direct, but you do have both of these at your discretion. So let's visualize this. I think it really helps to visualize these kinds of tests. So in a direct Coombs test, remember what we said, you're using your patient's own red blood cells. So you got your red blood cells, and your whole test is to determine, do they have these autoantibodies attached to them causing hemolysis? So you have your red blood cells, and they may have them, they may not have the autoantibodies, right? So in this diagram, the green antibodies represent autoantibodies causing hemolysis, okay? And then you add that to what's called the Coombs reagent. This is where the test gets its name. And the Coombs reagent is simply anti-human antibodies. So these antibodies will bind to just about any antibody that it has in its reagent mixture. So a positive test would be if you get agglutination, right? Because your patient's red blood cells have the autoantibodies already on them. And then the Coombs reagent, the anti-human antibodies, attach these different antibodies together, so you get agglutination. On the other hand, if your patient doesn't have these autoantibodies, they don't have an autoimmune hemolytic anemia, then their RBCs wouldn't have those on them to begin with. Thus, the Coombs reagent, or the anti-human antibodies, would have nothing to agglutinate. So you get no agglutination here, and that's considered a negative test. For the indirect, remember in the indirect, we said you're using donor blood. So the indirect, you have their donor RBCs without any sort of antibodies attached to them, just normal RBCs. And you add your Coombs reagent, same as before, your anti-human antibodies, and then you add your patient's serum, because you want to see if the serum has these anti-RBC antibodies, right? So you combine these things together, and same as before in the direct, positive result would be if you get agglutination, right? Because your serum would have the anti-RBC antibodies, those would attach to the donor RBCs, and then your Coombs reagent or your anti-human antibodies would agglutinate those RBCs together. And the negative test, same as before, there's no agglutination because your patient's serum would not have had the anti-RBC antibodies in them, thus not attaching to the RBCs. Thus, the Coombs reagent has nothing to agglutinate together. And so summing this all up, what could a positive test result mean? Well, generally, the most common thing we're looking for when we order a Coombs test is autoimmune hemolytic anemia. So these are things like warm agglutination, cold agglutination disease. Some liquid cancers like leukemia, lymphoma can cause a Coombs positive hemolytic anemia. Hemolytic disease in the newborn. Mono can sometimes cause this. Lupus and other autoimmune conditions, because that's the body basically making improper antibodies And then finally, transfusion reactions, right? So a hemolytic transfusion reaction can cause this as well.
I hope you found that to be a helpful discussion on the Coombs test. Like I said in the beginning of the video, it can be a little bit confusing when you think about the direct versus indirect components, but hopefully that sheds some light on the Coombs test.